Good afternoon, and thank you for joining us once again for our Lunch and Learns. Today's topic is testicular cancer, and this presentation is designed to answer the questions to what, when, why, and how. The overview of the discussion is this: what is testicular cancer? What causes testicular cancer? What are the signs and symptoms of the disease itself? It answers the question, is there a prevention or a cure for testicular cancer? How is testicular cancer managed? Through diet, exercise, and medication. And we look at the short and long-term effects of testicular cancer treatment. So let's begin. What is testicular cancer? Well, first of all, testicular cancer is a growth of cells that starts in the testicles. This is an abnormal growth. And the testes are, of course, are called testes, and they are located in the scrotum. And of course, the scrotum is the loose bag of skin underneath the penis. The testicles make sperm and hormone testosterone. So these are a necessary part of the male reproductive system. So what causes testicular cancer? The exact cause of testicular cancer is not really understood, but there are several factors that have been identified. One of those is undescended testicles, when as an infant the testicles fail to drop into the scrotal sac. A risk factor can be if family members, a father or a brother, who have also had testicular cancer. A personal history: if you've had cancer in one testicle, you're more than likely to develop cancer in the other testicle as well. Infertility and HIV and AIDS can all be a contributing factor to testicular cancer. Physical features: people born with hypospadia, which is the cause of the urethra opening being on the underside of the penis rather on the head of the penis, are at an increased risk for testicular cancer. Cannabis use: there's evidence that links regular cannabis use to the development of testicular cancer. And intersex variations. This is high risk in people with some intersex variations, such as partial androgyny or insensitivity syndrome. The androgyny is the development of both male and female sex organs. There's no known link between testicular cancer and injury to the testicles. Some people believe that it can be caused by sporting injuries, strains, hot tubs, wearing clothing that's too tight. And none of this has been proven to be true. So, what are the signs and symptoms of testicular cancer? Sometimes testicular cancer may have no symptoms whatsoever. And the most common symptom is a painless swelling or a lump in the testicles, or even a change in size or shape of the testicles. Less common syndromes include the feeling of heaviness in the scrotum, feeling of unevenness, pain or ache in the lower abdomen, the testes, or even the scrotum. An individual may also experience back pain, the enlargement or tenderness of the breast tissue due to hormone increase by the cancer itself. If found early, testicular cancer is one of the most curable cancers there is known, and this is why self-checking is important. Again, we looked at some of those symptoms, but it's important to remember that for some people, they experience no symptoms at all. So, how is testicular cancer diagnosed? If you're noticing changes, you should visit your general practitioner. This physician will examine the testicles for any lumps, swelling, any changes in size, or unevenness of the testicles. Other tests could include diagnosing testicular cancer would be like having an ultrasound to confirm the presence of a mass, blood tests, and these blood tests check for tumor markers, the alpha fetoproteins, beta, human chorionic gonadotropins, and lactate dehydrogenase. All of these occur with this excessive secretion of hormones that are stimulated by the tumors themselves. Surgery. The only definitive diagnosis for testicular cancer is surgical removal of that specific affected testicle. While many other types of cancer are diagnosed by biopsy, that is not the recommended treatment of choice for testicular cancer, and that's like removing a small piece of tissue from the tumor. And the reason being is cutting into the testicle can actually spread the cancer to other parts of the body. Hence, removal of the whole testicle needs to be removed if the cancer is strongly suspected. So, what are the risk factors for developing testicular cancer? We just touched on some of those briefly, so I want to go into a little bit more detail. Developmental factors that can create the risk for developing testicular cancer are cryptorchidismus. This is an undescended testicle that remains in the abdomen or the inguinal canal after birth. Germ cell neoplasia in situ. This is a precancerous condition that affects the germ cells in the testicles. Genetic factors that could put you at risk for developing testicular cancer are a family history. And generally, it's going to be a close family member. A father, a brother, a son with testicular cancer increases the risk of you having testicular cancer. Klinefelter syndrome. This is a genetic disorder that affects the hormone levels and the testicular development as an individual ages. Infections. HIV, which is the human immunodeficiency virus. Men with HIV have a higher risk of developing testicular cancer. Mumps or otitis, which is the inflammation of the testicles caused by mumps virus. Many people are extremely concerned with the development of mumps as an adult rather than a child because it puts them at risk for this condition. Other risk factors can be age. As we grow older, we have a higher risk for developing various types of cancers. And testicular cancer is most commonly found in young men between the ages of about 15 and 44. Race. White men are more likely to develop testicular cancer than that of men of different races. Abdominal testicle development. Certain conditions that affect the development of the testicles, such as hypospadia, may increase the risk for developing testicular cancer. What's important to note is that most men with these risk factors will not develop testicular cancer. However, if you have any concerns or a family history of testicular cancer, it's recommended that you talk to your provider about screening options. The question then is prevention or a cure? Preventing testicular cancer. There's no proven measure to prevent the cancer itself. In addition to the results of a diagnostic test, such as a chest x-ray or a CT scan of the chest, abdomen, and pelvic, they can be done to determine whether or how far a cancer has spread. Prognosis for testicular cancer. This means the expected outcome of the disease. An individual's prognosis regarding testicular cancer is going to be dependent on the stage and type of cancer, as well as the individual's age and their overall health condition. You may wish to discuss your prognosis and treatment options with your doctor, but it is not possible for a doctor to predict the exact course of disease. that may occur. All testicular cancers can be treated, and most testicular cancers are successfully treated. So, what happens after a diagnosis of testicular cancer? After finding out you have testicular cancer, you may, of course, be shocked, confused, anxious, or upset. These are very normal reactions, and the diagnosis of testicular cancer can affect everyone in different ways, and not just the person that's being diagnosed. This can affect the entire family. It can be difficult to decide what type of treatment to have. Understanding the disease and the treatments that are available to you and knowing the possible side effects can help weigh in on that decision as to what options are to be taken. You also want to talk to your doctor about how treatment for testicular cancer is going to affect your fertility. Screening for the cancer. There's no routine screening test for testicular cancer. While it's important to get to know the regular look and feel of your testicles and let your doctor know if you've identified any changes or anything unusual, there's little evidence to suggest that self-examination detects the cancer earlier or even improves the outcomes. Looking at the survival rates, about 95 out of 100 of men, that's approximately 95%, will survive their cancer for 1 year or more after they've been diagnosed. 95% of men, around that between 95 and 100 men, survive their cancer for 5 years or more after diagnosis. And about 90% of men will survive their cancer for 10 years or more after being diagnosed. So survival rates with testicular cancer are good, and hopefully with more research, they will improve even more. Survival if the cancer has spread. Researchers and doctors use a system to try and predict your outlook. This is for testicular cancer that has already spread outside of the margins of the testicles itself. Your outlook might be defined as a good prognosis, an intermediate prognosis, or a poor prognosis. And your prognosis is worked out slightly different depending on whether you have pure seminoma, testicular cancer, or non-seminoma testicular cancer. Your outlook depends on the staging of the cancer when it is diagnosed. That means whether it is spread to the lymph nodes or other parts of the body, the level of certain substances, such as tumor markers in the blood, and the types and size of testicle cancer also affects your likely survival. So how do we manage the disease? Well, first of all, a team of healthcare professionals will be needed to discuss the best treatment for you. This depends on the factors such as your cancer staging and the grading. There are different treatment options for testicular cancer. There's surgery, monitoring or just surveillance. There's chemotherapy, and there is radiotherapy or radiation therapy. Most people have surgery to remove the entire testicle at their first treatment for testicular cancer. After surgery, there may be a need for further treatments such as chemotherapy or radiotherapy. And you might even need other operations to remove lymph nodes from the back of your tummy or your abdomen. If the cancer has spread beyond your testicles, you may also have to have chemotherapy as your first line of treatment. So, what dietary recommendations are there? What's the best diet for testicular cancer? Eating plenty of foods rich in antioxidants. This is great for testicular growth, and it's good for your overall health and well-being. Fruits and vegetables are your best friend here. Prunes, raisins, blueberries. For individuals with testicular cancer, it is important that you have a balanced, plant-dominant diet rich in fruits, vegetables, whole grains, and lean meats, while limiting processed foods, fast foods, fried foods, red meats, and other saturated fats. So the foods we want to include, of course, are going to be our fruits and vegetables. And fresh is always best. If you cannot obtain the needed vegetables fresh, then your next option would be frozen and then canned as the last option. You should aim for a variety of colors to encourage a wide range of nutrients. Cruciferous vegetables such as broccoli, cauliflower, Brussels sprouts, cabbage, and kale are rich in fiber and phytochemicals. Berries such as strawberries, blueberries, raspberries, blackberries, acai berries are packed with antioxidants. When it comes to whole grains, we want to choose whole wheat bread, brown rice, whole oats, and other whole grains over refined options. And we want to avoid things that are made with enriched white flour. The foods we want to include in our lean meats, we want to include lean animal protein such as chicken and fish and turkey, as well as plant-based protein like beans, lentils, tofu. We want to make sure we are consuming healthy fats. Incorporate healthy fats from fat sources like avocados, olive oil, nuts, and seeds. Hydration is very important when you have a testicular cancer. Drinking plenty of water, especially during cancer treatment, to help flush out the toxins and replace the fluids that are lost by the side effects of these treatments. High protein foods. If you're experiencing a loss of appetite or muscle mass, focus on incorporating high protein foods in your diet. That can even include protein supplements and liquids and meal replacements. Examples of some high protein foods are going to be hard and soft cheeses, full milk, eggs, nuts, seeds, beans, lentils, and peas. These are all very important to include in your diet. The foods that we want to avoid are really quite common. They're the foods that all Americans should avoid. That's that processed food. Processed food, we want to reduce the intake of heavy processed and packaged foods, which often contain a lack of the nutritional value that we need, and they also contain unhealthy additives. We want to limit our consumption of red meat to no more than 3 to 4 times a week. Our saturated fats, trans fats, and polyfats, we want to avoid. Be mindful of these fats. They're found in fatty meats and in dairy products. We want to eliminate the F words from our vocabulary. It's not the F words you think, it's fried foods. Avoid fried foods as they contain unhealthy fats that can increase the inflammation. Excessive sugars. We want to limit our sugar intake, and it is a contributing factor to various health problems, to include diabetes. And cancers, like most bacteria and viruses, grow best in warm, dark, moist, sweet environments. Foods that increase the risk of foodborne illness, such as raw fish, sushi, raw eggs, unpasteurized milks and cheeses, as cancer patients have a compromised immune system, and the bacteria found in these foods can cause a serious infection to the patient. So, what are the short-term and long-term effects of testicular cancer treatment? Well, some of the short-term side effects of testicular cancer treatment can include fatigue, and that fatigue can be extreme at times, nausea, vomiting, hair loss, and depending upon the specific treatment methods, there can be other symptoms involved. Treatment for testicular cancer can sometimes lead to long-term effects, and this is something that should be discussed with your physician to help you before you start these treatments. It can have an effect on the heart and the blood vessels. You can be at risk for development of other types of cancers. You can have low testosterone levels, changes in sex and intimacy, effects on fertility, and effects on the body image. All of these can be long-term effects once treatment begins. So in summary, going back and just kind of looking at what we've discussed, it's important to remember that the exact cause of testicular cancer are not fully understood, but there are risk factors that have been identified. So knowing what those risk factors are can help you in early detection. There's no known link between testicular cancer and injury to the testicles, such as sports strains, hot tubs, or wearing tight clothes. Testicular cancer may have no symptoms at all, but the most common symptom is the painless swelling or a lump in a testicle or a change in size or shape. The only way to specifically or definitively diagnose testicular cancer is by the removal of the affected testicle. Biopsies are not recommended. Around 90 out of 100 men survive their cancer treatment for 10 years or more after diagnosis. There are different treatment options for testicular cancer, and those options should be laid out for the patient prior to any treatment. For individuals with testicular cancer, a balanced plant-dominant diet rich in fruits and vegetables, whole grains, and lean meats or proteins is recommended. And testicular cancer is treatable, and the best outcomes are those with early detection and diagnosis. The resources for the information that's been provided to you today came from the Lymphoma Leukemia Society, Harvard Health, the Mayo Clinic, the American Cancer Society, the Cleveland Clinic, and the YouTube video, Did You Know? That concludes my discussion. If there are any questions at this time, please put them in the chat and they will be addressed.